A stroke is a severe health condition. Why? By definition, a stroke is a brain attack. A stroke develops when the blood supply to part of your brain is cut off. Like the rest of your body organs, your brain needs a constant in and outflow of blood. Without this essential supply, brain cells begin to get damaged. These cells can even start to die very quickly. Understanding what a stroke is represents the first crucial step. Why? Because this knowledge empowers us to act fast and save vulnerable lives. The most common type of stroke is called an ischemic stroke. This type accounts for the vast majority of all stroke cases. Ischemic strokes are caused by a blockage in an artery that supplies blood to the brain. Often this blockage is a blood clot that forms elsewhere in the body and travels to the brain. Another type of stroke is a hemorrhagic stroke. It is less common than ischemic strokes, but extremely serious. A hemorrhagic stroke occurs when a blood vessel within the brain actually bursts or leaks. This causes blood to spill into or around the surrounding brain tissue. The leaked blood itself can damage brain cells directly. It also puts increased pressure on the brain, which can cause further harm. High blood pressure is a very significant risk factor for this type of stroke. Sometimes a weakened spot on an artery wall, called an aneurysm, can rupture and lead to a hemorrhagic event. Immediate medical attention is crucial for both types of strokes. Recognizing the symptoms of a stroke is critically important. Acting fast can save a person's life and reduce the chances of them becoming disabled. There exists a simple and effective way to remember the main signs. It is called the FAST test. The F in FAST stands for face. Ask the person to try and smile. Does one side of their face appear to droop or look uneven? The A in FAST stands for arms. Ask the person to raise both of their arms straight out in front of them. Does one arm begin to drift downwards? The S in FAST stands for speech. Ask the person to repeat a simple sentence. Is their speech slurred, jumbled, or strange in any way? And the T in FAST stands for time. This means it is time to call emergency services without any delay. You may be wondering and asking yourself, what happens during a stroke? The brain cells are suddenly deprived of their essential supply of oxygen and nutrients. Since they can no longer get what they need to survive, these cells begin to malfunction and then die within minutes. The specific area of the brain that is affected by the stroke will determine the exact symptoms a person experiences. For instance, if the stroke occurs in the part of the brain that controls language, the person will have trouble speaking. If it affects an area responsible for movement, they might experience weakness in a limb. The longer the brain goes without blood flow, the greater the extent of the damage. Recognizing these symptoms and acting fast can make a significant difference. Remember, every minute counts. Quick action can save lives and reduce the impact of a stroke. Stay informed and be prepared to act. Knowing fast well can be a lifesaver. There are several key risk factors that can increase a person's chance of having a stroke. In no specific order, the following factors can cause a stroke. First is high blood pressure, also known as hypertension, is a top culprit. Over time, high blood pressure can damage the walls of your blood vessels, making them weaker or narrower. Second is smoking tobacco. The harmful chemicals in cigarettes damage blood vessels and can make your blood thicker and more likely to clot. Third is diabetes. If diabetes is not well controlled, it significantly raises the risk of a stroke. Fourth is high cholesterol levels in your blood. High amounts of cholesterol can lead to the buildup of fatty deposits, also known as plaque, in your arteries, a condition commonly called atherosclerosis. This condition narrows the arteries, restricting blood flow. Being overweight or obese places extra strain on your entire cardiovascular system, increasing stroke likelihood. Also, genetics play a role. A family history of stroke can also mean you have a higher genetic predisposition. Finally, a lack of regular physical activity is another contributing factor to poor vascular health. Don't worry about risk factors that are beyond you, like genetics. The good news is that many strokes can be prevented by adopting a healthier lifestyle. How? Eating a balanced and healthy diet is fundamental. Ensure your plate has plenty of fruits, vegetables, and whole grains. Regularly be involved in physical exercises. It is beneficial, believe me. Aim to get at least 30 minutes of moderate intensity exercise on most days of the week. Maintaining a healthy body weight is also key. If you currently smoke, seek help and support to quit this habit. I have done a video on addiction. Be sure to look at it. Limiting your alcohol consumption is another positive step. If you suspect that someone is having a stroke, the most important thing to do is to act with extreme urgency. call your local emergency services immediately. Please subscribe, leave comments, and see you in the next video. Thanks for watching.